In the world's largest economy, emerging from pandemic disruption and persistent inflation, the United States faces a paradox in which cutting-edge healthcare coexists with widespread financial fragility. One of the most severe symptoms is medical bankruptcy, where rising costs, high deductibles, and opaque pricing turn illness into an economic shock. This analysis examines how healthcare debt undermines household stability, labor mobility, and long-term growth. To clarify this crisis, the article will assess its structural causes, policy failures, and macroeconomic consequences. The camera opens on a high-speed time-lapse of a modern American hospital at night. Its neon-lit emergency bay, a restless portal where life-saving technology meets the crushing reality of the bottom line. We begin with a quiet, structural tragedy. In the United States, a medical diagnosis is not merely a health event. It is a financial verdict. This is medical bankruptcy, a phenomenon almost unique to the American experience, where the very system designed to preserve life simultaneously threatens to dismantle it. For over 500,000 families every year, a single catastrophic illness or a freak accident, the one bill acts as a wrecking ball, swinging through decades of savings, home equity, and retirement plans. While the US leads the world in medical innovation and per capita spending, it also leads in the precariousness of its citizens' financial foundations. We are witnessing a paradox where the most advanced healthcare in human history has become the leading cause of insolvency. This documentary explores the invisible architecture of this crisis, a fragmented landscape of high deductible plans, opaque hospital pricing, and a debt collection machine that never sleeps. As we peel back the layers of the American ledger, we find that the medical safety net is riddled with holes, leaving the middle class just one diagnosis away from total collapse. The back of the American worker is not breaking under the weight of labor, but under the weight of a ledger they never chose to open. The signs of this systemic crisis are found in the quiet erosion of household liquidity long before the final bankruptcy filing occurs. Across the American heartland, from rural clinics to sprawling metropolitan medical centers, the indicators of a looming collapse are flashing red. We see it in the underinsured population, millions of Americans who technically have coverage but face deductibles so high that a single emergency room visit represents a month's worth of wages. Statistical data reveals a staggering trend. Nearly 40% of US adults report having medical debt, with a significant portion owing upwards of $10,000. The sign of crisis is the growing prevalence of the high deductible pincer, where insurance premiums rise in tandem with out-of-pocket maximums, effectively shifting the entirety of financial risk onto the patient. In the pharmacy aisles, the signs are found in prescription rationing, where individuals skip doses of insulin or heart medication because they are forced to choose between their health and their mortgage. The crisis manifests as a hidden delinquency. Medical bills are often the first to go unpaid as families prioritize food and utilities. Yet, these unpaid balances eventually trigger a cascade of credit score destruction. This is the stage of chronic vulnerability, where a routine screening or a sudden fever becomes a source of terror, not because of the physical ailment, but because of the surprise billing and out-of-network charges that lurk within the fine print of a policy. The American dream is being quietly strangled by the realization that health is no longer a right or a service, but an unmanaged financial liability that can go short at any moment. The mechanisms of this economic shock are rooted in a brutal deleverage cascade. When a major medical event occurs, the initial blow is rarely the end. It is merely the first domino in a sequence of financial failures. The medical shock starts with the depletion of liquid assets, savings accounts, and emergency funds vanish within the first 30 days of treatment. As the bills continue to mount, families are forced into high-interest debt, often charging five-figure balances to credit cards at rates exceeding 20%, or taking out home equity loans to cover surgical fees. This is the medical snowball effect. The shock is further amplified by the loss of income. Many acute illnesses that lead to high bills also lead to a loss of employment or a reduction in hours. precisely when the need for cash is greatest. This creates a liquidity trap at the household level, where the family must decide which debt to default on first. The impact on credit scores is devastating. Once medical debt is turned over to collection agencies, it effectively freezes the individual's ability to refinance existing debt or secure new lines of credit, leading to broader financial insolvency. This mechanical failure of the household budget proves that the American middle class is built on a foundation of debt-based health, where one's physical survival is inextricably linked to their process. Creditworthiness and a single biological error can lead to a total liquidation of their life's work. Global case studies and historical contexts provide a haunting contrast to the American experience, illustrating that medical bankruptcy is a policy choice rather than an inevitability. In other developed nations like Canada, France, or Germany, the concept of medical bankruptcy is virtually non-existent because healthcare is decoupled from personal wealth through single-payer or highly regulated universal systems. In these societies, a cancer diagnosis is a health crisis, not an economic one. Looking back at the US timeline, we see that before the mid-20th century, healthcare was relatively affordable. But as technology advanced and the system became increasingly financialized, costs began to decouple from the median wage. The 2008 financial crisis served as a stress test, revealing how many families were using home equity to hide their growing medical debt, only to lose everything when the housing bubble burst. More recently, the COVID-19 pandemic highlighted the employment insurance trap, where millions lost their health coverage exactly when a global respiratory virus made it most necessary. These global parallels show that the U.S. is an outlier in the industrialized world, maintaining a system that prioritizes the profitability of insurers and pharmaceutical giants over the financial stability of the citizenry. The lesson from history is clear. When healthcare is treated as a commodity rather than a public good, the final bill eventually breaks the back of the social contract. Within the United States, the impact of medical debt is a systemic drag on the national economy. It is not just a personal tragedy. It is a macroeconomic anchor that suppresses consumer spending and reduces labor productivity. When a significant portion of the population is buried under medical debt, they postpone major life milestones, buying a home, starting a business, or investing in education, leading to a stagnant economy. We see the impact in job lock, where workers remain in suboptimal or even toxic employment simply because they are terrified of losing their health. Benefits. This reduces the labor market efficiency and stifles the creative destruction that drives innovation. Furthermore, medical debt creates a secondary health crisis. People who are in debt often delay follow-up care or preventive screenings to avoid further costs, which ultimately leads to more expensive emergency-level interventions later on, shifting the cost back onto the public through higher insurance premiums and tax-funded emergency rooms. The hollow middle of the American economy is widened by this crisis, as the wealth that should be circulating in local communities is instead extracted to satisfy the balance sheets of massive healthcare conglomerates. Medical bankruptcy is the leak in the American engine, draining the vitality of the workforce and ensuring that the pursuit of happiness is perpetually sidelined by the pursuit of solvency. Government and central bank responses to this crisis have been largely reactive and fragmented. The Affordable Care Act, ACA, was a landmark attempt to address the pre-existing condition, barrier, yet it left the underlying cost curve largely untouched, leading to the rise of the high deductible plans that now drive insolvency. Government programs like Medicaid and the Children's Health Insurance Program provide a floor for the absolute poorest, but they create benefits cliffs that punish the working middle class for earning slightly too much to qualify for aid, while earning too little to afford private care. Recent No Surprises Act legislation has attempted to curb the most egregious forms of out-of-network billing, yet is often bypassed through complex legal loopholes and facility fees. Central bank policy, while focused on inflation, often ignores the structural inflation inherent in the healthcare sector, which consistently outpaces the consumer price index. The institutional response is a policy patchwork that provides temporary relief but fails to address the root cause, a system where the price of survival is unregulated. Without a fundamental shift toward price, transparency, and public option models, the government's efforts remain a series of band-aids on a patient who is rapidly bleeding out from a structural wound in their financial heart. Personal survival in the shadow of medical debt requires a proactive, defensive strategy. In a system where the bill is the primary threat, the individual must become a medical auditor. This involves never accepting a hospital bill at face value. Studies show that up to 80% of medical bills contain errors or upcoding that inflates costs. Survival strategies include requesting itemized billing and CPT codes to cross-reference with fair market price databases. Families must also leverage charity care and financial assistance policies, which many nonprofit hospitals are legally required to provide but rarely advertise. Useful insights for the viewer. You must understand the legal protections in your state. Some states have banned the practice of placing liens on primary residences for medical debt or have restricted interest rates on medical loans. Another key strategy is the Health Savings Account, HSA, as a long-term hedge, but only if the individual has the liquidity to fund it. Ultimately, survival is about risk mitigation, choosing the least worst insurance plan and maintaining a separate medical emergency fund that is never touched for other expenses. In the American economy, you must treat your health as a high-risk asset and protect your personal balance sheet with the same intensity that you protect your physical body. The remarkable closing message of this documentary is that medical bankruptcy is a symptom of a system that has forgotten its human purpose. We have seen how the mechanisms of debt, the inadequate safety nets, and the profit-first architecture have turned the pursuit of health into a financial trap. But the end of this story is not yet written. The crisis is forcing a national conversation about the value of life versus the value of the ledger. The remarkable message is that change is possible through systemic literacy and collective advocacy. When enough citizens realize that they are all just one diagnosis away from insolvency, the political will for universal protection becomes unstoppable. The lesson for the viewer is that your dignity is not defined by your medical debt. We are entering a period where the American people are reclaiming their right to a system that heals without hurting and provides care without taking the home. The medical bill may have broken the American back, but the American spirit is built for reconstruction. The future belongs to a system that is built to care, not just built to bill. And that transformation starts with the realization that in a truly prosperous nation, the cost of staying alive should never be the loss of everything you lived for. As we dig deeper into the societal and psychological impact, we find that medical debt leaves invisible scars that last long after the bankruptcy is discharged. The stress of insolvency leads to a decline in mental health, which in turn leads to further physical ailments, a feedback loop of decline. We see the intergenerational impact as young adults enter the workforce already burdened by the medical debt of their parents, or forced to postpone their own milestones to care for aging relatives. This is the erosion of the social contract. The impact on a person's life is a state of medical vigilance, where every physical sensation is filtered through the lens of, can I afford this? This anxiety suppresses the entrepreneurial spirit and the risk-taking that were once the hallmarks of American progress. The insight for the viewer is that we must destigmatize medical debt. It is not a sign of personal failure or poor money management. It is a systemic failure of a nation that has failed to protect its most vital resource, its people. By recognizing this as a collective burden, we can begin to move toward policy solutions that treat healthcare as a shared infrastructure, much like the roads we drive on or the water we drink. We conclude medical bankruptcy. The one bill that breaks the American back with a vision of the new healthcare architecture. We have explored the signs of crisis, the mechanical shock of debt, and the mechanical shock of debt, institutional failures that brought us here. But as the camera pulls back from the hospital wards and the bankruptcy courts, we see a rising movement for medical justice. The story of the one bill is a cautionary tale, but it is also a call to action. The remarkable message is that the American people have the power to re-engineer the system by demanding billing transparency, universal access, and cost controls. We can ensure that the next generation never has to choose between their life and their livelihood. The documentary ends not with a final bill, but with a final promise that we will build a nation where a diagnosis is met with compassion, not a collection agency. The back of the American worker is resilient. And once it is unburdened by the weight of systemic debt, there's no limit to what it can carry toward a brighter, healthier future. The era of medical fear is ending. The era of healthcare as a right is beginning. The future is healed.